Hi, this is Jessica DeMassa with WTF Health, and I'm here with Scott Barclay. He's a partner at Data Collective, or DCVC. So welcome, Scott. Good to talk to you.
Honored to be here. Thank you.
Thank you. So tell me a little bit about what you guys invest in.
Data Collective is early stage, deep tech, deep compute. So we want to back really technical, ambitious founders trying to change some arc of like the human experience. Health is one of the biggest areas we're dug in. I own a portfolio we call computational care, which is pushing compute closer to the patient and the person who touches the patient.
All right, what does that mean, pushing compute closer to the patient? Like, break that down in English or give me an example.
Well, I think you hear a lot of language around artificial intelligence, machine learning, deep learning. Consider 95% of that as hype. Data Collective understands the 5% that's real, and then we find those special nuggets of teams that can do huge things, and we help point them at huge problems, or we just get behind teams that already understand in their domain a deep problem.
All right, talk to me about the deep problems here, because this is fascinating to me, because there's actually been like a lot of conversation about that, about like solving problems that don't need to be solved in healthcare. So how do you make sure that the problem is right?
Well, in healthcare, unfortunately, that's relatively easy because we have outcomes that are entirely unacceptable. Even if we spent 10% of our GDP, like Switzerland, instead we spend something close to 20%. So it's not hard to walk around in this space and look for ripe opportunities. The hard part in this space is to ask, if you can solve it, how can you even get it to the logical place where it should go? Is there's kind of a hardened oligopolistic system blocking it? In general, what we find are deep industries where either the industry doesn't exist yet or the industry is ripe to be taken a crowbar to with these special early teams. And we want them to take big shots, and we try to back them to do that.
All right, and I know you keep saying that they're early teams. Yep. So like how early is early? Or like how cutting edge is the technology that they're working with?
One way to think about us, so we're a lot of capital. It's well over $1 billion, but we're a small team. And our entry point is always early, so seed or Series A. Some of the best things we've done, we were involved as the company was founded and wrote those very first checks. And in some cases, particularly if we think it needs a market winner, but it also has really special technology, we may not enter into the Series A. Now, we keep a lot of capital because we are very profound in the way we'll back certain types of technology-driven startups all through their life cycle, but we're really about finding that early team.
And how long have you guys been around?
Matt and Zach, the two founders, really got going in 2011. I became an operating partner about 3 or 4 years ago. I'm a full-on investing partner for about 18 months.
Okay. And now, what kinds of things are you looking for to invest in? Like, what's going on right now?
So I'm here at Health because we have this earlier portfolio, meaning we've been asking questions for years, and we're just starting to really put our money where our mouth is and asking, well, how can you turn that person who touches the patient, how can you turn them into a superhero? Okay. So for example, we recently invested in Swift Medical. Okay. This does machine vision on the smartphone at the bedside, but in a way where that $12 an hour technician suddenly is bringing a level of clinical and detailed observational intelligence into all the systems, and all they're doing is touching the patient with love and putting a sticker on them. The machine is doing these amazing intelligent things. So we look and see huge problems in primary care and the way that we diagnose patients. We back a ton of computational biology companies that do things like ask, how can we understand and identify cancer in a non-invasive way, just with your breath or with a small vial of blood. So we're after these really big problems where new unlocks in science or physics or deep informatics in health give you a new shot on something.
This space is so exciting, and it's also like one of the more challenging because a lot of times like there's just such difficulty with the established health system integrating these technologies in. Yeah. So from the investor side, how are you helping these early stage companies and guiding them so that their new technology, their new solution can better be integrated into the point of care or wherever it's being integrated into the system?
So it's a great question. And by the way, it's probably the number one reason that we pass on good, but what we think won't be great startups, is because we actually think that's hard.
Like it's too much.
And if we don't think we have a secret answer and they don't have a secret answer, we encourage them, but that may not be. We're after big returns. We do invest in things that sit on top of systems. So I have a company in Houston called Medical Informatics. It's on top of the ICU. I mean, talk about committee after committee. But we think there's a secret to how that company will get really scalable distribution. When we did Swift, the machine vision, that sits at the bedside, but it's already in almost every SNF, skilled nursing facility in North America, and very soon it's going to be in hospital after hospital and home health. We also are not afraid to push compute closer to the consumer or push compute closer into the home environment. And then there's lots of areas where we think we know what we're looking for, but we haven't seen something good enough.
Okay. What's the coolest thing you've invested in?
Well, I've mentioned Swift and I've mentioned medical informatics. So if I get to selfishly get one more in.
Yeah, get one more.
We're an investor in something called subtle medical. So there's lots of smart investors asking how can machine intelligence help the radiologist read the scan more intelligently. We ask, how can deep learning make the machine 90% faster? And that's something called subtle medical.
All right, I love to know what's hot, and then I love to know what's not. So what are you never investing in again?
I think I've now seen 133, and that's a technical answer, business intelligence analytics on top of the provider or payer to think about how we could build cohorts to do population health.
Okay, so we're over it.
Yeah.
Just done.
There might be some winners, but data collective has to be early. So at this point, that one's past us.
All right, last question for you. Yeah. So we ask everybody, WTF Health, so what's the future? So yeah, that's what it means.
Mm-hmm.
So what do you think the future is in this space? What do you have your eye on, I guess, in the next 5 years or so? I mean, what are you seeing emerging from these early startups experimenting with these different kinds of tech? What's heading down the road here? I'm
going to start with the criticism and then set the vision. The criticism is the founders who touch anything that you might call the provision of care are usually not ambitious enough. Okay. And I mean that with love, but lots of incremental things. The vision would be, you give it 10, 15 years, there's almost no part of the experience, and I'm even including hospitals, that shouldn't be transformatively rebuilt. And so what we want to do is back teams that have a view to how that can happen. It won't happen overnight, there's no one company, and we often are investing in little wedges into something we think opens into something bigger. But whether the innovation is coming out of a special system or whether it's going to come from something entirely full stack outside of healthcare today, there's almost nothing about the experience that'll be the same in 15 years.
Scott, it was a pleasure talking to you. Great insight, especially from an investor. Thanks so much.
Well, thank you for having me.
Thank you. This is Jessica DeMassa with Scott Barclay from Data Collective, DCVC, for WTF Health. Thanks so much.